Okay, so welcome to We're in This Together, Strategies for People with Parkinson's Disease and Care Partners. Before we get into it, I just wanted to talk about some upcoming PSSO events. They're both happening at the beginning of June. Sorry, I'm trying to move this slide, but it seems to not be working. There we go. On Tuesday, June 3rd, coming up in Guelph, we have Coffee with a Cop. This is just to get together with members of the Guelph Police Service. Both the traffic and fraud units will be there. And it's just to talk about different issues in the community. Sometimes people with Parkinson's their symptoms are confused for having consumed alcohol. So sometimes that can run into issues with driving and being served at liquor stores and bars. So we just need to kind of have open conversations about that. And also the fraud unit will be there for us to just talk about different issues. It'll be a roundtable discussion, not really any teaching or presentations or anything like that. There will be coffee and snacks. So if you're in and around the Guelph area, I encourage you to come on out. It'll be a helpful discussion. We did this last year and it was really well received with our community and including the members of the police service. So yeah, come on out. Also, we have our Care Partners workshop coming out. It is coming up. It is in Mount Forest. It's on Friday, June 6th, and it will be a day of learning and relaxation and reflection with some fellow care partners of people with Parkinson's disease. And just a reminder, care partners can include all kinds of family members, friends, anyone taking part in the team of healthcare and just like supporting the person with Parkinson's disease. So first we'll see Katie Muirhead, who's a manager at the Ontario Caregiver Organization. She'll be talking to us about managing stress as a care partner and also keeping in touch with the things that you like to do and the things that make you you, so you don't feel like you're losing your identity and letting all your hobbies go. So yeah, please, it's on the events tab in our website. Yeah, and let us know if you have any questions about that. Our walk for Parkinson's, it's still kind of a ways away, but we're well into planning and fundraising. There's tons of ways to get involved. You can put a team together and walk with us. You can promote awareness with your friends and family. You can go to our website for more information about that. And we're always recruiting volunteers. Our speaker for this webinar is actually the chair of our volunteer committee for our Waterloo Walk. So she can definitely answer some questions about volunteering. And yeah, it's really great how many volunteers we have, and they help us raise money and do what we do and make the day a success. I'll also just like to talk briefly about our Hero of Hope. This is our monthly membership program. So our monthly members donate gifts of any amount from $5 to $100, really at whatever is appropriate for the person. Any amount really helps. And this program really helps us sustain our services and programs across Southwestern Ontario. And being a monthly member also gives you the privilege to vote at our annual AGM to help determine our strategic directions. So please visit our website to learn more. It's under How to Help and our Hero of Hope program, or please just reach out to one of us on our PSSO staff team and we'll answer any questions you may have. So I'll just go over our agenda for our next hour together. Thank you so much for coming. we'll have our presentation just in a minute. And please leave your questions till the end. You can use the chat feature on Zoom, or you can just use the raise your hand feature, or if you're having trouble with that, just raise your voice, give us a shout, whatever you need. Please note this webinar will be recorded, so it's being recorded right now, and then it'll be sent to you along with any presenter resources. And for confidentiality reasons, as I mentioned at the beginning, for those of you who were early, the question answer period will not be a part of the recording. So I'll make sure that the recording is turned off for that time, and any personal details will not be shared outside of this webinar. So similar to support groups, this is a safe space. We can take advantage of having Olivia. She's really super knowledgeable about this subject and about supporting people with Parkinson's disease and care partners. And yeah, so feel free to ask anything, and yeah, we'll all respect each other's privacy in that way. So enough of me. I know we're here to talk to Olivia, so I'll let Olivia take it over for now.
Awesome. Thank you so much, Robin. Hi, everyone. It's nice to meet you. My name is Olivia. Really excited to be here today. I'm just going to shift over to my screen, share my slides. Just give me a moment here. Share my screen. Okay.
Oh.
Can you see my screen? I'm just pulling it up. Can you see that okay? Yeah? Okay, great. Well, it's nice to see everyone. And I'm really excited to share some strategies for yourselves today in honor of Caregiver Awareness Month. I did just want to preface that the strategies that we're going to learn today are not only for spouses or couples, but they're also for your family members, your friends, people you may work with or meet with in the community. So hopefully there's some strategies that you can take away from today and try out in your day-to-day life. And yeah, I'll look forward to any questions or interactions at the end. And there's a little bit of interactive pieces throughout. But I did just want to preface by saying I'm very grateful to be one of the graduate student scholarship recipients in 2023, as well as this year. And this work is being completed under the supervision of my supervisor, Dr. Jeff Holmes. And you may recognize him from a few of the other events that have happened in the past through PSSO. But without further ado, I'll just do a really brief introduction to myself. Usually I like to open up and get to know the audience, but just for the sake of the recording, maybe we can chat at the end. But my name's Olivia, as I mentioned, and I'm currently a third-year student at Western University in London. And I'm actually in a combined program where I'm completing research through my PhD, as well as an occupational therapy program, which I'm starting this fall. So I'm heading into my fourth year, and I'm really excited to work on my clinical skills as well as my research skills. This is a picture of me and my puppy. I really enjoy going for walks outside with my puppy Ted here. And something that my partner and I really enjoy doing together is beekeeping. He's more into it than I am, but we did successfully make about 40 jars of honey last year, and it's something that we've been really enjoying doing together this summer. So I tell you this because we're going to talk about some strategies to connect and communicate with our partners, and this is just some of the things that we like to do together. And just before we get into a little bit more about the research and the strategies, I just wanted to preface by saying I worked in long-term care for about 5 years before I started my PhD, and I worked really closely with persons with Parkinson's and dementia and other disorders and diseases. And I found that a lot of the time, the care partners or the family members weren't always involved in these really important conversations regarding care or activities in day-to-day within the long-term care facility. But also in the community, a lot of times these programs and services don't always include the whole care team. So I also found this within my personal experiences with my grandparents. This is my grandma on the screen. And down the road, I really learned that self-management strategies and not just relying on the healthcare services is really important. So that really is what kind of stemmed my interest in the research that I'm conducting, which really does revolve around this idea of self-management. So self-management is a concept that involves all the different pieces that help us live well and manage our day-to-day life. If we have a disease or a disorder or any type of chronic condition, it's things like movement, exercise, making sure we can get to our medical appointments, taking our medication on time. Are we eating well? Can we get our groceries? Are we sleeping? Are we connecting with people? Do we have the right tools and resources to do what we need to do? Things like that. So self-management we know is really important, but when there's so many people needing these specific resources to help us manage our disease, for example, there's 46,000 people in Ontario with Parkinson's, and 10,000 of those people are just within Southwestern Ontario. So you can imagine, as you know, and as you've likely experienced, there's really long wait lists and wait times for these special services to help you feel like you can confidently manage your symptoms and disease symptoms. So self-management and learning how to confidently take care of yourself in these different areas of your life becomes really important. So that you can feel confident that you can take care of yourself and your family member, and the whole care team is supported. We also know that this idea of self-management doesn't just impact the person living with the condition or the disease, like Parkinson's disease, it impacts the whole family. So whether it's your siblings, your friends, your son or your daughter, or all the members that you interact with in the community, self-management is a team effort. And that's why today we really want to emphasize this idea of team-based approaches and that we're in managing the disease together. So I'm just going to shift this up so you can see my screen. But just to take a look at the research, this is something that myself and my colleagues from Western published recently, actually just in April. And this is something called a scoping review. So basically you're looking at all the research that exists around the world, and you're kind of getting an idea of the common themes or ideas that are coming up within that specific research area. So something that I was curious in is self-management is so important, and a lot of times care partners are left out of these types of programs and services. So let's take a look at all of the research that exists and see, first of all, how many programs exist for people with neurodegenerative movement disorders. So that includes everything from Parkinson's disease to PMP to Huntington's disease, etc. And it turns out only 34 exist around the world, which is not a lot when you think about it. And this is published. So this is the research piece. 34 research programs exist. And of those 34, only 11 of them were actually intentionally designed to support the care partner's specific needs. So we know that someone living with Parkinson's will have specific needs, and the care partner will have specific needs. Some of them may overlap, but not all of them. So it's interesting that only 11 programs actually took into account what the care partners might want and need in a program. And then out of those 34 programs, only 8 of them included strategies for both members of the dyad. So when I say dyad, I'm talking about that team. Maybe it's a husband and wife. Maybe it's a father and a daughter, etc. Maybe it's a friend. There's only 8 programs that include strategies for them to work together, which is so interesting. And the biggest surprising factor that we found is that out of all 34 of these programs, only one of them wasn't conducted in Canada, and that program was in Quebec. So that really shows that we need to learn more about self-management and supporting the dyad with disease management in Canada, and especially in Ontario, where there's such a large number of people living with Parkinson's. So that brings us to the research topic that I'm really focusing on for my dissertation, which is taking a team or a dyadic approach to self-management. How can we work together to manage the disease effectively, and what's involved in that? So just an overview, a few of the research studies that we're involved with involve really trying to understand the care partner's perspective on what self-management supports and services are needed, especially in Southwestern Ontario. And then we want to talk to healthcare providers and implementers who deliver these programs and understand what the barriers might be to implementing these services, what helps implement these services, and how might we overcome those barriers, especially in this really messy healthcare system. And then we want to apply all of these findings to ultimately improve the existing programs and services in the region. And maybe we can scale it up and offer more programs across the province. So a lot of the conversations that we have with people living with Parkinson's and healthcare providers, care partners, family members, these same kind of topics keep coming up. And these are really the key things that people suggested that resources would be really helpful for. So for example, support through all stages. We know that each stage of Parkinson's is so different, and there's going back and forth between symptoms, and sometimes we don't want to learn about everything that could happen but might not. So it's best to learn as things come about and how can we support or get support during this stage. Another thing that comes up a lot is, who do we reach out to when we need support, and how can we get help at home? That's really tricky to navigate. We know our healthcare system can sometimes feel a little bit hard to navigate. So we're trying to understand how we can maybe support people with Parkinson's and their family members with that. How to cope positively and feel connected with your family, your partners, your community. And finally, how to have these important but difficult conversations and communicate with my partner. And this is something that we've really focused on over the past year or so because it's come up so often. So the purpose of today's webinar is really going to focus on this idea of working together to have difficult conversations and connect and work together as a team. So this is another research study that we recently published, and we asked care partners in Southwestern Ontario how they manage difficult conversations. And we found that Parkinson's really does add layers of complexity to these already difficult conversations that you might already be having as a team with your family. But Parkinson's just adds that extra bit of complexity. And we also know that Parkinson's makes it so that these conversations evolve and change over time, which can be challenging to navigate and know how to prepare for. We also found that there's 4 really common types of conversations, and we'll learn about those today. Some of the most important findings of this research is that we can make these conversations a little bit less difficult by strengthening our connection in our relationship, but also working on our communication skills, which is something that we can all work on. It's hard, but we can do it together. And things like finding faith or having positive coping and beliefs about yourself and managing the disease in the process can be really helpful. And also feeling prepared for conversations and connected with your care team, with your partner, can be really helpful for having these important conversations. So today, we're going to talk about why communication can feel hard and how we might be able to overcome that. I can imagine that communication may feel challenging when you don't know what to say, how to say it. Maybe there's something on your mind that's been really bothering you. Maybe there's something that your partner is doing that's really aggravating. You don't want to bring it up because you don't want to hurt their feelings. Or maybe it's something that's really sensitive and you're just avoiding it. You don't want to think about it. These are all really common, and a lot of people express that these are the things that make communication so hard. So with the research in mind and some evidence-based strategies, we're going to talk about a few different steps to approach the conversation, identify what type of conversation that we're having, how to soften a hard conversation, and how we might be able to connect with each other and build our relationship without having to talk or communicate with each other. So the first step is approaching the difficult conversation. There's a lot of times where we might have something that's really bothering us. We're feeling like something's upsetting, frustrating, and we really just want to tell the person what's bothering us. Maybe we snap at them, we tell them something that's upsetting. Maybe it's just venting. And we sometimes approach these types of conversations with a me versus you lens, where we think, I'm right, I'm proving this to you, or maybe I just want to get this off my mind and tell you. But sometimes when we approach these types of conversations in this me versus you manner, it can be hard to engage and open up with each other after that comment that you make. So the first thing that we can do when we're feeling really overwhelmed by these big emotions like frustration, anger, maybe it's sadness, is take a pause. So you can press the pause button. And this can look like talking with your partner and saying, you know what, let's take a pause. We're both upset. This is really frustrating. It's not really your fault. It's not really my fault. Let's just take a pause and take a moment. Once you've had a moment to take a second, we're going to take a deep breath. So you'll see this circle on the screen. It's expanding and shrinking. You can maybe think about this in your head. You can follow along if you want, but you're going to breathe in through your nose for 4 seconds and breathe out through your mouth for 4 seconds. And in the moment, it might be hard to take the time to do this. But after a few deep breaths of in for 4 and out for 4, you can ask yourself, okay, how can we tackle this problem as a team? It's not me versus you. It's us versus the problem. Maybe you're leaning in to listen to what your partner's really saying, feeling empathetic towards what they just learned or what they're frustrated about, and then thinking to yourself, okay, how can we set this aside and work together as a team to approach this? So first, take a pause, take a breath or 2 or 3, and then connect. So a lot of times when you're looking at the person or holding their hand or just a soft touch on the arm, it's really hard to stay upset in the moment, especially when you're looking at someone. If you're sitting beside someone now and you look at them in the eyes, usually whatever's on your mind dissipates, or those really big feelings just feel a little bit smaller. Then you can ask a connection question. Maybe the person just needs to feel heard and share what's on their mind. So can you ask an open question? After you pause, you breathe, maybe you look at each other, ask a question. Once you've been able to do those 3 steps, you can ask yourself, okay, once you start talking as a team, is this the right time to have this conversation? Are there people around? Are we at the dinner table with another friend? Maybe you have your grandkids or your kids around. Is this something that can wait? Do we need to go into a separate room while we take a pause and talk about this privately? Is this something that we need to do right now, or should we think about what we're trying to say or how we're feeling and come back to it? There's no rush. Maybe you start the conversation, start explaining why you're frustrated, or maybe how you've been feeling lately, and it's not going well, so you just take a break. You can pause and set a time to return and come back. And just keep in mind throughout this that you're working together as a team. So trying to think about what's going to benefit yourself and also your partner in this time to work together to solve whatever problem or work towards whatever problem you're trying to improve or achieve. Another helpful strategy is identifying what type of conversation we're having. So sometimes you might be going back and forth with your partner and you're not really sure why they're bringing this up, or maybe you have something you want to bring up, you're not sure how to say it. Identifying the type of conversation that you're having or that you want to have can really help you feel prepared for having that tricky conversation. So from our research, we found that there's 4 common types of conversations. They're all difficult, but the first one is called difficult conversations. And this is something that might be really hard to start the conversation about. So maybe you've noticed something new in regards to your health. Maybe it's a new symptom. Maybe something's come up and you're worried about a future trip or plans for the future. If it's a relational conversation, this is more so about a venting situation where you're trying to share your thoughts and your feelings, and you're not really looking for a practical, solution-based conversation. A frank conversation can look like someone being blunt with you, expressing a need, whether that's in a nice way or an abrupt way, maybe sharing that they need more help or more space, or they just feel tired or worn out, whatever it may be. Planning conversations are those conversations about what are we doing? Are we, making a decision about care? Are we making a decision on behalf of the family with finances, whatever it may be, but kind of preparing for something that takes a team likely to approach. So with these 4 types of conversations in mind, we can understand and think about what we might be able to do. So for example, if you're having a difficult conversation and someone's bringing up something really vulnerable or hard to talk about, maybe you want to get a little bit closer together and take a look at each other in the eyes and really focus on what they're saying and be in the moment. That's really helpful for all of the type of conversations, but especially those hard ones that person might need to feel that extra support during. Relational conversations are those about thoughts and feelings and maybe venting. And a lot of the times the person wants to just feel heard and feel seen. So open-ended questions are really helpful for these types of conversations. So if you're not sure how to respond, asking an open question like, can you tell me more about that? Thank you for sharing. Can I hear more about how you're feeling? How does that make you feel? Things like that. Open up the question. Frank conversations. A lot of times this starts as a need or a demand or a statement that might be really blunt. And the person on the receiving end oftentimes might feel a little bit like, oh my gosh, like what's your problem? What's your issue, right? But if we take a second and really lean in and think about, okay, my partner's upset, my partner's frustrated, maybe my partner's worried about something. Let's set our feelings to the side and make room for both of our feelings. And let's lean into this and think about how we might be able to talk through this together. Planning conversations. Say, you've got an appointment to get to, something's wrong with the car, you need to work together to figure out a solution. Maybe something's happened with the family, the finances, and you need to make a meeting. How can you work together to come to a solution? Is there someone else that you can bring into the conversation from the family? How can you make a team and work together as a team to solve the problem? So this is a little activity. Feel free to unmute yourself or put in the chat. But just to apply kind of what we're learning here, this is just an example. I'm going to kind of share the situation and maybe you can guess what type of conversation this could be. So for example, I'm making dinner. We have some family coming over. I'm trying to rush to get the vegetables ready and prepped. I'm feeling really overwhelmed. and I say, I need more help. I need more help with making dinner. I'm feeling overwhelmed. What type of conversation do you think this might be? Our difficult conversation, a frank conversation, relational, or planning? So when we feel prepared about the conversation that we're having, whether we know what to say or not, if you can identify the type of conversation that you might be having or the conversation that you want to have, you might not be ready to have it in that moment, but maybe you do want to share that symptom or that something is on your mind. You can think about these different strategies and what might be helpful in that moment for that different type of conversation that you're having. Now, the next step or the next strategy is really about that language that we use and how it's so important, especially when talking with someone like your spouse or a close partner that you interact with frequently. And some of the biggest stress we have about having difficult conversations is that we don't know how to start the conversation. We don't want to start the conversation. Maybe we avoid it altogether. But a lot of times, if the conversation feels like it's really hard, sometimes those are the most important ones to have. So hopefully these tips can help you prepare, know what to say, even if it feels weird to say it out loud. These are some examples of how you could maybe open up a conversation. It can be as simple as, hey, can we find some time to talk about this? Maybe, tonight, or maybe sometime this weekend when we have some downtime. Or maybe you are in the middle of some downtime and you think, okay, this is a good time. Can I tell you something? I've been holding this in. It's been on my mind for a while. Or maybe you bring it up abruptly and you say, you know what? I've been feeling pretty stressed out lately. Can we talk about it? And the responsibility of the person on the receiving end is to try to be as curious and compassionate as possible. I'm sorry if you can hear what's in the background. There's a train that goes right by my house and it's going by right now. I'm not sure if you can hear it. But when you're listening, can you respond curiously and compassionately? So keeping in mind your feelings, but also your partner's feelings. So acknowledging that, you know what, this might be really hard for them to bring up. So I'm going to thank them for sharing that with me. And then maybe ask an open-ended question. Can you tell me a little bit more? I don't really know what you mean. Or can you help me understand that? I'm having a hard time understanding. Or, oh my gosh, I didn't realize you felt that way at all. Let's talk more about it. Whether it's in this moment, or maybe it's in a day or two when you've had some time to think about it. A lot of times these conversations don't happen perfectly. You're in the moment, things come out, you say things you don't mean, or that you wish you bit your tongue, you didn't say it. So you might say things like, what the heck? I already told you that. Don't you remember? Or you can't do that anymore. Please don't do that. You're going to fall, or it's not going to go well. Just don't do it. Or things like, I do everything around here, or anything along those lines. And a lot of times we say it out of a place of love and compassion because we really care and worry about our partner. But a lot of times when we say these types of things, it can come across as a bit, hard to swallow. And a lot of times it just takes away the autonomy of the other person. So a lot of these hard conversations can be softened. And we've got a little feather here on the screen to remind us that when we're feeling frustrated or worried or anxious, there's always a way to say it a little bit softer. And you'll notice that a lot of the sayings on the left side of the screen are really pointed at the other person. So a lot of times this is that me versus you approach. On the right side of the screen, we have a lot of statements that start with an I. And it really shows that you're thinking about how you can work together as a team. So for example, on the left side, something that might be said is, I already told you that, don't you remember? Maybe if you take a pause and a breath and connect, you remind yourself, okay, maybe they didn't remember. It's okay. I forget things too. A softer way to say it could be, I've mentioned this before, but it's okay. Should we write it down so you don't forget? Maybe we'll put it on the calendar on the fridge so that it's, we both see it and it's on both of our radars. Or maybe, please don't do that. You can't do that anymore. You're gonna fall. Like, we don't want to deal with that. Maybe a softer way could be, okay, I know how important it is to you to do this, whether it's going down the stairs or maybe it's, doing an activity that this person likes to do, but might not feel as confident doing. Let's figure out a way that we can do this and make it feel safer together. Like, let's think about this as a team. And another example, I do everything around here versus I'm feeling pretty overwhelmed. Can we talk about how we could share some of the load, or maybe we could get extra help? Maybe this is a conversation that you bring in another family member in or a friend, or maybe you're reaching out to the community to find a resource to help you with the things to make it feel a little less overwhelming for whoever might be doing those tasks or activities. And just remember, whenever you're having these types of conversations, you can always pause and then breathe and connect at any point. It doesn't have to be in that order either. You can always, usually you're looking at each other when you're having conversations, not always, but you can start with eye contact and just holding the hand. Take a deep breath together, pause together, and ask a question or continue with the conversation. But just keep in mind, are we in a good space to do this? Is it a good time to do this? Do we need a little bit of time to think about what we're going to say? And how are we going to approach this as a team? It's us versus the problem. And number 4, how do you feel connected with your partner? Is it going on walks, doing an outdoor activity? Maybe it's playing cards. Maybe it's physical touch, like cuddling or hugging or even giving a kiss on the cheek, whether it's your partner or a family member. Going out for dinner or having friends over for dinner, whether it's just another couple or maybe you're having a bigger dinner party. Is that how you feel connected with your partners and your team? Or is it through words of encouragement? I'm so proud of you. I'm so happy for you. You know what? You look really great today. Things like that. The other piece that we found in our research is that not only working on these communication strategies is really important, it can help actually carry out the conversation, but working on connecting with your partner in your day-to-day or your week and carving out that special time for yourself and your partner can really help build your relationship and your connection with each other. And that can make these conversations just go a little bit more smoothly because you might feel more safe, more connected, more compassionate towards your partner. So just a few examples. Maybe you already do some of these. If you're having coffee in the morning, make another coffee or a tea, or maybe it's just getting a glass of water for your partner and bringing it over to them. You don't necessarily need to have a conversation or talk during this. You can just bring it over, set it down, acknowledge them, give them a hug, whatever it may be. And it's just a little act of kindness. You're thinking of them. A short walk or fresh air, whether it's in the morning or in the afternoon, sitting outside, enjoying the nature, listening to the birds. You can just sit there and notice all the different types that are flying in and out. You don't need to talk. You can talk, but you don't have to. Maybe you're sitting there, you're holding hands. Maybe you're just in each other's presence and you're feeling connected. Making dinner together. If you both want to stand and do share the load of cooking and prepping, maybe you're picking a recipe together and your partner is making it for you. Or maybe you're both sitting down at the table, chopping veggies and, getting things done as a team. You don't have to talk. Maybe you have nice music on in the background. Doing yoga or Tai Chi, we know that these are really great, especially for Parkinson's, mobility and movement. And it's really good for mindfulness as well. But you just sit in the class and listen to the instructor speak. You're there together. You carved out the time to be there together. And you can participate as a team. And you don't necessarily need to have a conversation. Doing puzzles or cards, if you're really serious players, I know you're not having full-on conversations during this. And finally, a movie night. So maybe you're picking a movie that you both like. You're sitting there. Maybe you're there with your whole family. Maybe you're actually going to the movies with a friend. Maybe you and your spouse or your partner are picking a TV series that you catch up on each week. All of these activities help us connect with our partner, our friend, or our family member, and they don't require talking. So if you just don't want to talk, that's okay. If you do want to talk, these are also great times to have those conversations or bring up those hard conversations. Maybe not during your yoga class, but maybe while you're sitting listening to the birds or having your morning coffee. So just to summarize, we talked about 4 different steps to approach the conversation, identify a type of conversation you might be having, how you could maybe soften a hard conversation, and how you might be able to connect without necessarily having a conversation, or maybe you're connecting during that time and that can start the conversation. I just want to leave you with some gentle reminders. So every relationship, as you know, has its challenges. And unfortunately, Parkinson's just adds that extra layer of complexity. It changes over time. People's reactions might change over time, and it can be really hard. But the most important thing is your willingness to show up and to keep trying together as a team. Because working together on your relationship and on these communication and connection skills is an act of care and love for each other. And just always know that you're not doing anything wrong. These conversations are hard to begin with for anyone at any stage. It's just hard sometimes. And some days are easier than others. But working together as a team, that us versus the problem mindset will get you further than doing it on your own. And just know that you're never alone and there's always support. You just have to reach out. So don't hesitate to reach out for those supports. I'm going to leave you with some resources or some people who might be able to help with different communication difficulties or challenges. I'm not sure how many of you are familiar with speech language pathologists, but this therapist can help you with your speech, with voice, and with swallowing. Sometimes we feel like the hardest part of the conversation is that we can't find the right words. We actually can't project our voice. Our voice is getting quieter. So the speech language pathologist can help you amplify your voice, find your voice, and find strategies to speak a bit more clearly. They can also give you some tools for non-verbal communication. So maybe there's some other strategies that you can use to convey what you mean without actually having to speak. And there's also programs that you may have heard of, like the Loud and Big program, where you can improve your voice strength and clarity. Social workers, we know, are so important. They do so many different things. They can help support you with your relationship, different stressors, planning for the future. They're really great with guiding family conversations and connecting you with services. Counselors or psychologists are also great resources. They can offer individual, couple, or family therapy sessions similar to social workers, and they can help you explore those emotions or those communication skills that you want to build on. They can also help you with things like depression or anxiety if you're experiencing that. Occupational therapists can help you adapt to your daily routines and roles. So maybe a lot of these hard conversations are coming up because of things that are happening in your day to day. And occupational therapists can help you change up your routine or maybe find some strategies to improve your day to day activities so that you can feel more supported. Maybe it's sharing tasks or doing things a little bit more independently, or maybe it's just finding ways to communicate more effectively with your partner. Support groups. I'm sure many of you have heard about the support groups or are already a part of the support groups that are available, especially through the Parkinson Society of Southwestern Ontario. But it's a great place to connect with your peers, share your experiences, strategies, advice, vent, share your thoughts and feelings if you'd like to, because it's a safe place to talk about challenges and solutions and all of those sorts of things. And of course, Parkinson's organizations such as the PSSO is a main resource for you. There's obviously lots of education, workshops, webinars like this. And we have obviously a lot of amazing staff, most of who are on this call today. And they offer you different programs, resources, communication advice, things like that. And we also have the resource specialists who can connect you with these types of supports within the community. So please don't feel alone. There's always supports depending on what you need. You just need to ask the right people the right questions. So I just want to leave you with a few take-home messages today. Really want to emphasize to take a team approach whenever possible. It's helpful to identify the type of conversation that you're having so you can plan and maybe prepare. Pause, breathe, and connect before you continue the conversation when you can. Always start with curious and compassionate questions when you're feeling like this conversation is hard to talk about. Really open it up so you can understand what your partner is trying to tell you. Take a break whenever you need to. And ask yourself, is there a way that I can soften what I'm about to say? And finally, make time for connecting with your partners, whether it's your spouse, a friend, a family member, a colleague, someone in the community. It's so important for the quality of your relationship to take that time. So I just wanted to conclude there. Thank you so much for joining. If you ever want to reach out to me with any questions or anything of the sorts, I put my email on the screen here. But I'll stop sharing my screen and thank you so much for joining today.